I'm Dr. Jason Pozner from Boca Raton, Florida, and I'm the guest host on No Spin Live. We have three very exciting stories to talk about, and we have three guest surgeons. First guest surgeon from Princeton, New Jersey is Adam Hamawy. Say hi, Adam.
How's it going?
And the esteemed Peter Fodor from both Aspen, Colorado, and Beverly Hills, California.
Hello all.
And as usual, we have my buddy Dan Del Vecchio from Boston, Massachusetts.
Go Celtics.
So I'm
Right.
not you. I'm also not your buddy. I didn't know that.
Yeah, you're my buddy too.
Okay.
Probably you were my buddy before he was my buddy.
Okay.
All right. So we have three exciting stories.
Buddy system.
The first story is pretty interesting, and we've covered it a little bit on No Spin, but it's a bit about teens having plastic surgery. And there's some new data that says that 230,000 teens last year between the ages of 13 and 19 had some sort of surgery, whether it's filler or surgery itself. So Adam, why don't you take this, as you're the youngest in this crowd, and tell us a little bit how you feel on this.
I just look the youngest, not necessarily the youngest, but so, you know, there's good reasons for teenagers to have plastic surgery that we know of. I mean, just because you're a teenager doesn't mean you can't have it. It's the why that really makes a difference. You know, normally we look at maturity. We want to look at, you know, whether they're physically and emotionally mature. We want to look at the reason why they're getting it. Is there a physical reason or an emotional reason? And, you know, we want to make sure that these are all legitimate. I think one of the things that we're looking at now is what the impact of social media is having on why they're doing this. And this is where we have to get clear. Is this just a fad, or is this a real legitimate reason to have surgery that is going to impact, you know, how they're going to be seen, you know, themselves, and how they're going to see them in the future?
Why don't you comment on the Snapchat dysmorphia issue, where people are taking pictures of themselves and trying to show what they're, you know, they want to look like what they look like with their filters on Snapchat?
Well, that's the problem with the filters, is that you look at it, you know, your skin is like smooth. You could shape your face any way you want, and it's like a cartoon character. And the fear now is that people are going to try to look like these cartoon characters in real life, and you can't really achieve that. You're just going to end up causing problems that way.
Right. You know, Peter, I think it's a big difference between an 18-year-old with asymmetric breasts having a reduction or a surgery to make her more symmetrical than a 13-year-old who wants her lips filled. I mean, why don't you comment on that and take the story up a little bit?
Well, you're absolutely right. And, you know, what we have to remember as plastic surgeons is our job to kind of guide the patients and guide the parents. And there's a lot we can talk about here, including the fact that if the parents don't necessarily want to go along with justifiable surgery, we have an issue there also, not just the other way around, even though most of the time is the teenager who wants the surgery and the parents don't want to have her or him to have it. But let's remember, just like as Dr. Hamawy was saying, a lot of surgeries are justifiable. A kid at 5 years old, his ears are totally grown, he's crying, everybody's calling him dumbbell and antenna ears and taxi cab with the doors open and whatever. He's very determined to have surgery. You can basically do it with no anesthesia. That's how motivated they are. And that's justifiable. When I started plastic surgery, we didn't do noses before the age of 18. And then I did a study out of residency, followed patients for 10 years. And we offered the operation to people who were in the very early teens to show that their bad noses did not grow back and that we helped them significantly during their adolescent development. So there's a lot to this. But all in all, I think there is a real problem with the SNAP dysmorphia, which can lead, of course, to body dysmorphic syndrome, which is a real issue. And we as plastic surgeons have to help patients and guiding them through and guiding the families through.
Well, that was really very comprehensive answer. And I love hearing about these studies that were performed some years ago that we've kind of lost along the way. I mean, I wasn't aware of that study on the rhinoplasties in the young kids. I think that's phenomenal.
As a result of that study, George Peck lowered the age in his textbook when the noses should be done. It was published in PRS from what I recall, but I followed them for 10 years. And yes, it was an interesting study. It was interesting to see how you could help those patients.
Wow. Okay, Dan, you're up. Why don't you comment on this? Have you seen any younger teens coming in for buttock augmentation?
People who clearly have nasal problems, just as an example, clearly have nasal, their noses aren't so good. They'll put little buttons and things on them to camouflage. I don't think there's anything wrong with that. I mean, at some point, if you're going to have body dysmorphia, you're going to find a way to manifest it. And I don't indict Snapchat as much. It's just another way people already have. I don't think it's a chicken egg thing. I don't think Snapchat elicits people to have body dysmorphia. I think it's the other way around. I think people who have body dysmorphia use Snapchat because it's easy for them to change their appearance.
But you don't think people are maybe looking at themselves a little bit more now? Because I watch these kids now, they spend their whole time sending pictures of themselves. Hey, I'm eating my cereal. I'm having a hamburger, that's all they do.
I think if you look at the number of hours people use their smartphones, it's like averaging 9 to 12 hours. So basically 90% of your active daily life is now you've got the phone in your hand. But I think that's more of a generational thing. In other words, we didn't grow up with smartphones. I see 2-year-old kids scrolling pictures. It's like it's just going to become more and more pervasive.
Whether using your smartphone or not, that's one issue, and everybody does, even our generation. I think a lot of people are using them. You go to a restaurant, and even in restaurants, people are on their phones all the time, Subway, whatever. But as far as body dysmorphic syndrome goes, or disorder, it's much more common than it's realized. You're absolutely right, Dan. It's in some studies, up to 20% of the population has some degree of it. However, Snapchat dysmorphia can be something to awaken the predisposition for something like that, which is there anyway.
Sounds good. Okay, let's move along to our next story. So there's a pro long distance runner, Stephanie Bruce, who's been posting some pictures of herself on social media after her birth of her second child. And what's happening is she has a lot of diastasis and loose skin in the lower abdomen, and she's very thin, and she's been posting pictures about this and how young mothers should be aware of that this could be a potential problem, even though she's running and back to competing. So Peter, you have the most experience here with excisional body contouring. Why don't you start on this topic?
First of all, when I read what she published was something like her diastasis recti, according to her, was 1 centimeter, 1 finger brush she mentioned. When you look at the picture she shows, there's distended skin around there, and most likely is much, much wider. But if it was 1 centimeter or even wider than that, and we're going to come into discussing surgery for diastasis recti, it can be done endoscopically. We published that in a book we published on endoscopy a long time ago, and basically with no scar, a small periumbilical scar and a small scar just above the pubis. But as far as a patient like that, a person like that goes, I congratulate her, I applaud her for wanting to come out public and say she had the surgery. Maybe she'll have other women who are pregnant and will end up with diastasis recti, whether they had it already before pregnancy or not. It can be either way. And the fact that she decides to talk about, and she's fine with it, and she doesn't want to repair it, that's her business. At the same time, these things can be very nicely repaired surgically. And not only that it helps with the diastasis recti, but also like a concept of a corset. It's been well proven on good studies that good abdominoplasties help with backache because they tighten the abdominal wall, which of course it gets even better if the people doing exercising also.
I mean, it's funny, I did a man recently who had some diastasis, and I did him endoscopically with some mesh on top of it. So I thought it was an interesting case. Adam, why don't you comment on this?
You don't need to fix this if it's not bothering you, but I think she's an important example to show people who think that they could go to the gym and work out, and they're driving themselves crazy after having some children and trying to fix this diastasis that's never going to be fixed. And you could point to her and say, listen, here's a marathon runner who's an athlete, and it's just going to be there no matter what you do. And you could either not fix it like she is, or you could have surgery. So I think it's a good way to cut to the chase for someone who keeps saying that I'm just going to wait a little bit longer so that it'll go away maybe if I work out a little bit more.
I mean, when I looked at this woman's pictures, I took one look and I said, she needs a tummy tuck.
Right.
And I think that if you ask probably 99 out of 100 plastic surgeons in the U.S. would say the same thing. She has loose skin and diastasis and otherwise thin. So I think she's a great tummy tuck candidate. Let's move on. There was a recent photo in social media of Madonna who was doing a song, and I guess had one of her relatives, her son, was on the bass. And there were some pictures of her buttocks. And it looks like she had something done, and there's been a lot of social media things going back and forth about her buttocks, and then some comments saying, well, she said, well, it's my body, I can do what I want. But let's kind of address this. One, let's see, did she have anything done? What do you guys think of this? And obviously, whatever she wants is fine by the rest of us. It's her body. But Dan, why don't you start with this? You're the butt expert on the panel.
Jason, I think there's a growing movement kind of in the high end kind of celebrity circles for having hyaluronic acid injections done by reputable non-surgeons, dermatologists in Beverly Hills. I've seen a lot of it. I think we're probably aware of the people without mentioning names. And I think there's this mentality afoot that if it's not an operation, if it is no incision, if it's incisionless buttock augmentation, which was what people have called it, it's okay. And I would bet you, gentlemen's bet, steak dinner at, Abe and Louie's in Florida or wherever, in Boca, Glades.
Or in Boston on Newberry.
That Madonna had hyaluronic acid injections in her lower pole. It kind of makes her buttock look kind of cuffed out instead of like high and then straight. It's kind of like a half moon. You usually can get that with hyaluronic acid.
How much do you think should they put in?
I mean, people are putting in like 300 cc's in each side.
Oh.
Yeah, I mean, it's
a lot of money.
Yeah, and sculpture too.
Sculpture, I've done.
$30,000 to $40,000, $50,000. If you take like a syringe, and it's 500 a syringe, and you're doing like 20 syringes, it starts to add up.
Fortunately, some of that will absorb, but you're absolutely right. I've seen quite a few of these patients also, and it is it's very typical for the Hollywood crowd. They can afford practically any surgeon, but they don't always make the right decisions. Look at some of the most horror story botched up so-called jobs, whether it's Donatella Versace or Sylvester Stallone or Jocelyn Wildenstein. All these people who really have the means to pick the best, and meantime they go for approaches that maybe, like you said, Dan, sounds attractive because in their minds is non-surgical.
It's so hard to tell exactly what's going on because we're just looking at a picture with her having her pants on. But assuming that she's gotten an injection, or even if it's not, it doesn't look natural. And I think the problem is when you're a celebrity or someone who's important and you're dictating your care, often we end up, rather than achieving the results that we want, we end up with something that most people will find unattractive rather than attractive. So I think it's really important, if you are trying to, get something done, is to listen to whoever your doctor is or your surgeon is and listen to their advice rather than trying to dictate what you want, and then you end up with something like this.
I agree. It didn't look too good. Sounds good, everyone. Very nice call.